My name is Jeremy Sasse. Today we'll be discussing childhood obesity. The target audience for this presentation will be parents and their children 18 and younger, and this presentation would take place at a community health fair. So to begin this lesson, we'll talk about the objectives for the day. By the end of this presentation, I would expect the participants to be able to describe what obesity and what childhood obesity is. I would also expect them to be able to describe what health risks children that are obese are at risk for. And they should also be able to describe the treatment options for childhood obesity, especially those treatment options that relate to a change in diet and a change in exercise. So to begin the presentation, I would ask the audience, what is childhood obesity? And this first question would cover objective 1. After I ask this question, I would expect to hear some answers back from the participants attending the presentation. And some answers I would expect to hear back would be, obesity is someone who's overweight, which that is right to a point, but the answer which I'm actually looking for is that childhood obesity is when a child is above normal weight for their height and for their age. Once I define what childhood obesity is, I'd ask the audience or the participants if they had any questions referring to obesity, and if not, I'd move on to the next question or to the next slide. And the next slide would cover childhood obesity and the health risks involved. So once again, I'd start off this slide by asking the participants, what are some health risks that children are acceptable for if they are obese? And I would expect to hear back, they could develop diabetes, or they may develop high blood pressure. And both those answers are definitely correct. Some factors, some health risks which the participants may not be aware of would be, say, somebody who is obese could develop arthritis, or gallstones, or gout, even cancer, or heart disease. And the main three health risks I would definitely want to cover would be high blood pressure, diabetes, and heart disease, because these are the main three health risks that somebody is at risk for eating for if they are obese. After I cover these health risks, I'd once again ask the participants in the audience if they had any questions referring to the health risks. If not, I would move on to the next slide, which is our first activity. In this first activity, I would have the parents and children in the audience calculate their BMI, and I also have them perform a skin fold thickness test. These tests are to determine their body mass index and their body fat percentage. So the first activity we would do would be calculating their BMI. To calculate their BMI, participants would multiply their body weight in pounds by 705. Then they would divide that number by the square of their height in inches. So an example of that is for someone who is 168 pounds and is 5'10", their calculation would be 168 times 705 divided by 70 squared. And that would give them a BMI of 24. So once they have their BMI number, they would then look at a chart that is provided to them to determine where their BMI ranks as far as their risk for disease and their health classification. So based off our example, the example gave us a BMI of 24. That would put this particular person in a healthy weight range at a very low risk for disease. The levels of health classification include severely underweight, healthy, obese, and severely obese. So after they were to receive their classifications, we would then move on to the skin fold thickness test. And this test determines their body fat percentage. And to calculate their composition, what I would do is have each parent and child get a pair of pressure calipers, and with these calipers, if they are a mom and daughter, or if they are dad and son, The mom and daughter would take measurements of their triceps, their saprillium, and their thigh skin folds, and the father and son would take their measurements on their chest, their abdomen, and their thigh skin folds. And then based on the measurements that are taken, the participants would look at a chart that's provided to them and determine their estimated body fat percentage. Once every participant has finished both of these activities, I would ask them if they had any questions referring to BMI or to the skin fold thickness. And I'd also ask them if they had any individual questions based off their individual results. And if not, we'd move on to the next slide. But I would expect this activity to take about 20 to 25 minutes just because the skin fold thickness test does just take a while to complete. The next slide covers objective 3, and this is the treatment options for obesity. So with this slide, I'd start off by asking the participants in the audience what do they believe some treatment options are for obesity. I would expect to hear back, some answers I would expect to hear back would be a change in diet or an increase in exercise. And both those answers are definitely correct, but there are also some other options as well. Other options are pharmacotherapy along with surgery. Pharmacotherapy is the use of medication prescribed to you by doctors, and surgery, of course, would be like a stomach tie, where they actually tie your stomach, so it makes it smaller and allows you to intake less food. It makes you less hungry. But before you do any pharmacotherapy or surgery options, I would definitely suggest an increase in exercise, an increase in physical activity, and then a change in diet. And I'd honestly expect to hear questions from the audience as in, what are some physical activities that we could participate in to help us lose weight, to help us fight obesity? What are some ways to change our diet? So as far as the physical activity goes, I would tell the participants, you should run, you should bike, you should swim, you should do anything cardio related, just to get that heart rate up, to get that fat burning. And then change in diet, I would recommend a diet which is high in fruits, high in vegetables, low in sugar, low in carbs, maybe high in protein. Just stay away from sugar, from soda, any highly just fatty foods, because they're not going to do you any good in the long run. From after I discuss the treatments, I'd ask the audience if they had any questions. If not, we would move on to the next slide, which is actually activity 2. And to start out activity 2, I would start off with a short video which discusses exercise options to help participants lose weight or to help them maintain their fitness if they've already lost some weight. Following this video, I would have the parents and children in the audience partake in an exercise circuit. The circuit would include push-ups, sit-ups, air squats, and running in place. And each activity would last for 3 to 4 minutes at a time, with maybe a 30-second break in between. So overall, this activity 2 should probably take roughly 20 to 25 minutes. And the reason I'm having the participants do this activity is because it allows the children to learn what exercises they can do on a daily basis if they don't have access to a gym, or say the weather's bad outside and they can't go outside and be active, they can't go play. Then all they have to do is find some space inside their house, and they can do all these activities because they're all body exercises. So all they really need is a little space and then just the will to be active. So following this activity 2, I'd ask the audience if they had any questions pertaining to this activity, pertaining to the circuit, and if not, we'd move on to the next slide. And what the next slide does is it covers the HDMIs I used in this presentation. So the first HDMI I used was the linguistic intelligence. I use this throughout every slide, through discussion and through just teaching the participants. And that covers objective 1, 2, and 3. I then use the kinesthetic intelligence, which was used in activity 2, which covered objective 3. And this was when the participants were partaking in the exercise circuit. I also used the interpersonal intelligence. This was used when asking the participants questions. And that covers all three of my objectives. Then I used spatial intelligence. This was used through the use of pictures through my presentation and through the use of the video I showed in Activity 2. So this also covered objectives 1, 2, and 3. And then lastly, I used the mathematical and logical intelligence. And this was used in Activity 1, which covers Objective 1 and 2. And this is when the participants perform their BMI and the skin fold test. They had to actually calculate and use math to determine what their body mass index and what their body fat percentage was. And that covers the HDMIs that I used. And the last slide would be the references I used for my presentation. I used our book, another fitness-related book, and then a few websites. And today that covers childhood obesity. Thank you.